These are some diagnosis and general foods to avoid. I do have one medication in here. This is not an all-inclusive list of every single thing that to avoid, but these are some of the important ones to remember. Let's jump right into it. End-stage renal disease. These individuals should avoid high potassium and high phosphorus foods, as the kidney cannot, when they're in the end-stage renal disease, they cannot remove these from the body. And so foods high in potassium include avocados, citrus, bananas, cantaloupes, dried fruits, and prunes. These are just some of them. Also, potatoes are on there as well. Foods high in phosphorus include things like dark colas, chocolate, and dairy foods. On the renal unit, we would always give patients grapefruit juice versus things like orange juice and any kind of high potassium juices. And then also we would have sherbet to avoid high phosphorus, so we wouldn't give them ice cream. As far as gout, eating too many foods that have purines can actually cause a buildup of uric acid in the body. So we want to avoid high purine foods. This includes things like organ meats, also processed foods like bacon, beef, pork, anchovies, scallops, sardines. Seafoods in general are important, and also alcohol is important to avoid. And then moving on to MAOIs, this is an antidepressant group. They block the breakdown of tyramine foods that are found in the body and foods. When tyramine is elevated in the body, it can actually elevate the blood pressure to very dangerous levels, and it can also cause cerebral hemorrhage. So foods that should be avoided include things like aged cheeses, processed meats, pickled or fermented foods, citrus, alcohol, dried or overripe fruits. Moving on to hypertension, we want to avoid high salt foods. Can't even talk today. Salt causes fluid retention, which does increase the blood pressure. And then celiac disease. This is an autoimmune disease where the body has an immune reaction to gluten-containing foods. So we want to avoid foods like wheat, barley, and rye. And these are just a few. And then finally, IBS. There is a FODMAP mnemonic, which represents the foods that can actually flare IBS. So if you want a specific video on any one of these, just comment below which one you want. Also, make sure to like and follow along for more videos like this.